Hey folks, so I want to talk to you about the 4 big things you can do to help with your low back pain. The first one is release techniques. The second one is traction. The third one is breathing. And the fourth one is activation. So let's go back to that first one there, release. What do I mean when I say release? I'm talking about releasing musculature and soft tissue. So that means like a muscle, a tendon, a ligament, fascia, some of those kinds of structures. Some of the structures you'd be interested in releasing would be like your gluteal muscles, your hip flexors, your lower back muscles, your mid back muscles, the ligaments of your iliolumbar ligament and your SI joint ligaments. Those are some areas that you want to be really interested in releasing because they're very important when it comes to lower back pain. It can also be important to release some of your abductors and your adductors on the in and outside of your hips and your groin. Those can also be really helpful to release too. But we want to start releasing some of the muscles in those areas. And if you've done proper assessment, then hopefully you've found out which muscles are kind of your hotspot areas that tighten up the most, and maybe what you need to be releasing the most. Now, after that, it's good to also, in a sequence, right, you release first, then the next thing is traction, the second thing that you would do. Traction is good because it starts to pull the spine apart. Okay, this is something that almost feels like medieval torture, but now it's therapy. Now it's a really great thing for your spine, and it should feel really good when you do this. This is something like laying face down on a Swiss ball, just lying on your back on the ground, somebody pulling on your legs, doing a hanging from a pull-up bar, like the inversion tables, although I'm not a huge fan of inversion tables. I feel like people do them kind of incorrectly, but something that's going to take your body and pull the spine apart so that way the vertebra actually slightly move a little bit. They get some spacing in there, and that will rehydrate the intervertebral discs and really help with the pressure on the discs. It'll relieve the compression that we're getting by being vertical, feeling gravity, sitting down all day long. It's going to decompress, it's going to traction, it's going to open up the spine and feel really good. Both of those things, release and traction, feel really good, but if you don't follow that up with some stuff to activate all of your core muscles and balance out some of that musculature in there and the soft tissue, then you're just sort of putting a Band-Aid on things. You're just making them feel better, but you're not doing the long-term work you need to do in order to actually get results that feel good. Okay, so you release, you traction, but now we've got to do some stuff to activate, and that's going to come in your breathing and in your muscle activations. So breathing is going to move your entire spine if you breathe correctly, okay? When we take a breath in, we are moving the diaphragm, we're moving the rib cage, the lungs are opening and closing, and that is moving your spine in the areas that your lungs are moving, right? If your lungs are opening up your thoracic cavity, your rib cage is expanding, then your thoracic spine is going to be moving with that expansion. If you bring your breath down into your belly, then your lumbar spine is going to be moving with that expansion. This can help to activate and deactivate all of the musculature in your whole torso, your chest, your abdomen, your back muscles, get a little bit of movement in that spine. This is a great way to start activating all of that musculature. Lying on your back, taking deep, slow breaths, changing the movement of your breathing, breathing into your chest, breathing down into your belly, trying to breathe out sideways, changing your rhythm of breathing, the pacing, how fast you breathe, slowing it down, changing the timing. That all really helps you to focus on calming down your body, relieving stress, decreasing chronic pain and inflammation, and getting your whole torso and your spine to move and activate in a way that's not high intensity, right? We're not going out doing box squats or jumps or anything like that, right? Really low intensity, just breathing, that's it. Super simple. Okay, the last thing here is activation. And I say activation as opposed to exercise or strengthening because these are really small movements that are just meant to turn a muscle on, right? It's not necessarily you actually creating hypertrophy and building new muscle growth. This is just you getting that neurological, that brain connection from the central nervous system down to a muscle so that you use that muscle more often, right? You're just trying to, low-level stimulation of that muscle. This can be something like doing little dead bugs or bird dogs, or just taking your glutes or maybe your psoas muscle, your abdominals, your lower back muscles, some of those core muscles that we were releasing earlier, and we're basically turning them back on again. So we kind of turn them off, and then we breathe, we traction, right? And then we turn the muscles back on again. So just going through the most minimal, lightest, most focused muscle activations you can do is really beneficial. Those are the 4 things that if you do those, that's really going to help your low back long term. If you do just one of them, it's usually just a band-aid. You've got to do them together, and you've got to do it in that sequence: release, then traction, then breathe, then activate. Okay, I hope this helps. Stay healthy, guys. Thanks for watching.